Okay, so let's talk about feedback loops so that hormones can stay at a very controlled level in the bloodstream. Otherwise, the hormones in the bloodstream would be really poorly regulated in terms of how much hormone there is. So let's start at the top, where the hypothalamus is able to release hormones to then stimulate the anterior pituitary to release its hormones. Okay? Um, the anterior pituitary hormones, such as ACTH, TSH, FSH, LH, they go into the bloodstream and they have their effect at the target organs. Okay? So the target organs produce their hormones. So in the case of the testicles, it would be testosterone. In the case of the adrenal glands, it would be cortisol. In the case of the thyroid gland, it would be thyroid hormone. And those hormones will have an effect on their target tissue. Okay, so FSH and LH from the pituitary gland will cause secretion, will stimulate the ovaries to release progesterone and estrogen, which will have its effect on their target tissues, such as the uterus, okay, or the breast tissue, for example. Now, those hormones that are now in the bloodstream can feed back. So testosterone or cortisol or thyroid hormone can feed back to the anterior pituitary and the hypothalamus to inhibit further secretion because there's enough hormone in the bloodstream. So as the level of a particular hormone, say testosterone, starts to drop, well, there won't be a negative feedback loop. So the hypothalamus and the anterior pituitary can release more FSH and LH. Another example would be, say, for example, the hormone, the thyroid hormone from the thyroid gland. Well, it has its effect on all its target tissues, but it also feeds back through the bloodstream to the hypothalamus and the anterior pituitary to turn them off, to let them know that there's enough thyroid hormone in the circulation. You don't need to keep on stimulating me with hormones that are stimulating the thyroid gland. Okay, so that's the concept of negative feedback. Okay, and it's all about controlling the level of hormones in the bloodstream. Okay. Let's look at another negative feedback loop that has nothing to do with the pituitary and hypothalamus. What about insulin? So insulin is secreted by the pancreas into the bloodstream when serum glucose is elevated. And as insulin is secreted, it works on cells around the body to allow glucose to enter the cells. As the serum glucose level drops, that's going to have a negative feedback loop on the pancreas to reduce insulin secretion. Okay? Otherwise, if insulin continually was secreted, the patient would become hypoglycemic. Okay, so this negative feedback loop concept is really in order to control the levels of hormones within the bloodstream. Okay, so this slide I don't think I need to spend too much time on. In terms of the pituitary gland, I already spoke about the fact that it's controlled by the hypothalamus, by hormones that can stimulate the pituitary gland to release hormones into the bloodstream, and also the hormones that are secreted by the pituitary gland stimulate other different endocrine organs in the body. And when those hormones are produced, by the different endocrine glands. They have a negative feedback loop back to the pituitary and the hypothalamus to reduce their hormone production. Okay, so we spoke about the fact that the anterior pituitary has direct hormone production. It produces hormones that are controlled by the hypothalamus because the hypothalamus secretes hormones to stimulate the secretion of anterior pituitary hormones. Posterior pituitary gland stores two hormones called antidiuretic hormone and oxytocin, both of which are produced in the hypothalamus. Okay, if this is a repetition and you want to skip to the next slide, no problem. But let's do each one of these. So anterior pituitary, okay, it's responsible for thyroid function. The thyroid gland in your neck. Okay, so thyroid releasing hormone comes from the hypothalamus. It goes down through that little bloodstream to the anterior pituitary and stimulates thyroid stimulating hormone, TSH, to be secreted into the bloodstream. TSH goes to the thyroid gland and produces, or tells the thyroid gland to produce T4 and T3. T4 is going to be the main hormone produced by the thyroid gland. Okay, T4 will have a negative feedback loop back to the pituitary gland, where it will tell the pituitary gland that it's at a good level in the bloodstream to stop releasing TSH. Okay, so there's its negative feedback loop. Ovary function. So follicle stimulating hormone and luteinizing hormone released by the anterior pituitary to stimulate the ovaries and testicles, to produce estrogen and progesterone in the case of the ovaries, and testosterone in the case of the testicles. And those hormones will have a negative feedback loop to the pituitary to reduce FSH and LH secretion. So it's really a fantastic way of keeping hormone levels at a very, very tight level and control in the bloodstream. Okay, what about adrenal function? So corticotropin releasing hormone from the hypothalamus stimulates secretion of ACTH from the anterior pituitary that then goes and stimulates the adrenal glands to produce and release cortisol into the bloodstream. Cortisol feeds back to the anterior pituitary and the hypothalamus to inhibit further secretion of ACTH and CRH. Okay. Growth hormone secreted by the anterior pituitary to regulate growth of bones and muscles and overall metabolism in the body. And we'll talk more about that. Breast function, well, prolactin is secreted by the anterior pituitary to help with milk production and mammary gland maturation in the breasts. Okay. Posterior pituitary, antidiuretic hormone released by the posterior pituitary to act on the collecting ducts and tubules in the kidney to reabsorb more water, more fluid. Okay. Oxytocin, again, released by the posterior pituitary to stimulate uterine contractions, in particular during labor, that then helps dilate the cervix to allow labor and delivery. It also stimulates the breast to allow milk let down into the breast ductules, and finally the release of milk so that the infant can nurse. Okay, so again, this is just a different image of the same concept that we're talking about. The anterior pituitary being on the left here, and the posterior pituitary hormones being on the right. So the hypothalamus um, has an assortment of hormones that it can release to control the anterior pituitary. And when stimulated, the anterior pituitary can then release hormones into the bloodstream to have their effects on different endocrine organs around the body. Okay? Posterior pituitary have direct nerves from the hypothalamus to the posterior pituitary, where ADH and oxytocin are stored and then can be released into the bloodstream. Okay, so when we're thinking of the pituitary gland, well, if everything is working just fine, the hypothalamus is controlling the pituitary gland. The pituitary gland is able to secrete its different hormones into the bloodstream that then have various effects around the body based on the endocrine organs that they're affecting. Okay, so when can things go wrong? Well, you can have pituitary tumors. So there's different tumors that can develop in the pituitary gland that can over-secrete certain hormones, such as excessive secretion of growth hormone or excessive secretion of TSH, thyroid stimulating hormone. So remember that that little gland called the pituitary gland can develop tumors within it that secrete particular hormones. Someone who's had a significant head injury or a brain injury, the pituitary gland can malfunction. Someone who's had brain surgery can impact hormone secretion by the pituitary gland. And finally, if there's been ischemia or some kind of blockage of arteries to the pituitary gland, well, some of the pituitary gland can then be injured or die, and that's going to affect pituitary gland secretion. Okay, so you can have hyposecretion, meaning undersecretion of certain hormones, or you can have oversecretion and overproduction of certain pituitary hormones. Okay, so I would look at the image on the right first and see how incredibly small the pituitary gland is compared to the brain. Okay, it really is a tiny little gland that has so many functions. Okay, and to remember that it really is controlled by the hypothalamus. Okay, and also controlled by all of these negative feedback loops that are coming back to it. So what are disorders of the pituitary gland? Well, we mentioned some already. Tumors of the pituitary gland, which will be called pituitary adenomas. They're not typically malignant. They're overgrowth of certain cells in the pituitary gland that lead to excessive production of certain hormones from the pituitary gland. Okay. Surgery or radiation treatment to the brain can injure the pituitary gland. Previous history of an infection, such as meningitis or encephalitis, can injure the pituitary gland. I mentioned infarction, which is loss of supply to the pituitary gland, can injure it. And also if there's a hemorrhage into the area, that would lead to pituitary gland dysfunction. Okay, so this slide is really just showing you the sequence of events for different hormones. So the hypothalamic hormone that leads to pituitary secretion of a hormone that then goes to different target endocrine organs in the body, and then the principal actions of those hormones that are released by the target organ. Okay, so if we look at, say, the pituitary hormone ACTH, that's going to stimulate the adrenal gland, in particular the adrenal cortex, leading to the release of cortisol or corticosteroids into the bloodstream. follicle stimulating hormone and luteinizing hormone are going to stimulate the ovaries or the testicles. In the ovaries, estrogen stimulates the follicular development in women, and it also stimulates sperm production in men. Luteinizing hormone will trigger ovulation in women, and in men, it will increase testosterone levels in the bloodstream. Okay. When we look at growth hormone, well, there's a growth hormone releasing factor in the hypothalamus, leading to secretion of growth hormone from the pituitary. What are the target organs? Well, there's so many tissues involved that have receptors for growth hormone. And it regulates the growth and development of bones, muscles, cartilage, and overall metabolism of the body. Okay? Okay, I won't spend too much time on this one since we've already done it. We've spoken about prolactin and where it has its effects. We've spoken about TSH from the anterior pituitary and how it stimulates the thyroid gland to then release thyroid hormone. There's one that's less important, MSH. We didn't speak about it, melanocyte stimulating hormone. The target organ is the skin to stimulate pigmentation in the skin, right? Which then protects us against UV radiation. Okay, and again, I won't spend too much time on this slide because we've spent some time talking about it already. And I know you've heard the term antidiuretic hormone many, many times. So the antidiuretic hormone, okay, increases water reabsorption from the collecting ducts. Okay, we know that. What triggers it to be released? Increased osmolarity of the blood, okay? Or a decreased blood pressure can be sensed, and that can lead also to EDH secretion. Okay, so, and that makes sense. If it senses a decrease in blood pressure, well, you'd certainly want more EDH secretion to occur so you can reabsorb fluid to maintain blood pressure. Okay? Oxytocin, well, that's the one that actually has a positive feedback loop. So what does oxytocin do? Well, it stimulates uterine contractions, and it allows for milk letdown and release of milk from the breasts. Okay? So the positive feedback loop, which is a bit unusual because most of them have negative feedback loops, the more that an infant is breastfeeding will result, in more oxytocin secretion, right? So, and that makes sense because the more that the infant is suckling or breastfeeding, the more milk down you want. Okay. Follicle stimulating hormone, I won't mention again here, and luteinizing hormone we've already covered. Okay, so let's talk about hyperpituitarism. So what that's referring to is excessive production and secretion of a particular hormone from the pituitary gland. Okay, and by far the most common condition causing this is a non-malignant pituitary adenoma. So it's an excessive growth of a particular group of cells that make a particular hormone. Okay, so depending on which group of cells have developed an adenoma, which is basically a benign tumor, will determine which condition the patient will develop. Okay, so if there's excessive production of ACTH, adrenocorticotropin hormone, then they'll develop Cushing's disease that we'll discuss. If there's a group of cells in the anterior pituitary that's producing excessive TSH, then they'll get hyperthyroidism. because the TSH will overstimulate the thyroid gland, producing excessive thyroid hormone secretion from the thyroid gland. Okay? And if there's excessive growth hormone, that will lead to, depending on the age of the patient, if it's a child, it will develop gigantism because their growth plates are still open. So the long bones can continue to grow and grow and grow, leading to gigantism. If it's in an adult, the growth plates are closed, so it will lead to a variety of other symptoms, and the condition is called acromegaly. Okay? Now, the most common pituitary adenoma is called a prolactinoma. So it's a group of cells in the anterior pituitary that have formed a benign tumor of the cells that produce prolactin. And it leads to excessive prolactin secretion into the bloodstream. So what will a prolactinoma cause? Well, let's think about excessive prolactin levels in the bloodstream. And typically, prolactin has anti-estrogen and anti-testosterone-like effects, anti-androgen effects. Okay, so in women, due to its anti-estrogen effects, it will lead to irregular menstrual cycles, or possibly even no menstrual cycles, called amenorrhea. It will cause a milky discharge from the breast because prolactin stimulates the breast to make milk, okay, to produce milk. So patients can come in and say, I have milky discharge from my breasts, and we call that galactorrhea. Okay. Painful intercourse. Why? Because there's a inhibition of estrogen. It blocks estrogen effects, so it can lead to vaginal dryness. And lastly, it can lead to excessive body and facial hair, because when you block estrogen in a female, you allow the androgen effects to override the estrogen effects, and that leads to acne and excessive growth of hair. Okay. Now, what about in males if you have too much prolactin? Well, it's going to block the testosterone, since males have predominantly testosterone as their sex hormone, and it will lead to erectile dysfunction. It can lead to decreased body and facial hair because it's blocking the testosterone. And lastly, it can lead to gynecomastia, so enlargement of the breast because of its effect on the breast, and actually it can cause some milky discharge in males as well. Now, if you think about a adenoma that's growing in the pituitary gland, it's going to grow and grow and grow, and it's going to start to compress the other cells in the pituitary gland that were producing, say, ACTH or TSH or growth hormone. And that can lead to a deficiency of those hormones, right? So if we're talking about a prolactinoma, you may end up with lower levels of ACTH, TSH, and growth hormone. Okay. What else is going to occur as a pituitary adenoma enlarges within the pituitary gland? Well, right next to the pituitary gland is where the optic nerves coming from each eye meet at what's called the optic chiasm. So it's going to put pressure on the optic chiasm and stop the signals from going from the retina to the visual cortex, which is the occipital lobe in the back of the brain. Okay, so that can lead to visual disturbances, and also it can lead to headaches, right? Because of what it's doing locally, right? So as it enlarges, it's causing headaches and it's causing visual changes and potentially visual loss.